Depression, bipolar, anxiety. Odds are you know someone suffering from a mental illness. But it's difficult when that person refuses to get help. At times, it can even mean calling police. But is that really the right thing to do? News Channel 5's Kelsey Gibbs talked with one sheriff who says it's time for a change.
Being mentally ill isn't a crime.
Therapists, social workers, advocates, and law enforcement all gathered in Nashville to attend the 2019 National Council for Behavioral Health Conference.
I think our law enforcement departments want to learn from our mental health professionals.
Social worker Patricia Costellas traveled from Long Beach, California to discuss how mental health providers and law enforcement can work together hand in hand.
I think more and more these days law enforcement's called on too often to serve like therapists or social workers in the streets and in our jail systems.
It's a thought Dickson County Sheriff Jeff Bledsoe understands too well.
We don't want to criminalize the needs of patients.
Sheriff Bledsoe is working with all Tennessee Sheriff's Departments to change the law.
Sheriffs are given that authority or that demand to transport the mental health patients.
The law requires police officers to transport mentally ill patients to a treatment facility center if they are a threat to themselves or others.
It does put an extra burden on law enforcement, and it's intimidating.
Then we show up and all of a sudden we have to use law enforcement. That can sometimes compound the problem because some people just feel like they're not being treated properly.
Sheriff Bledsoe says that responsibility can no longer fall on law enforcement.
We're not the best option at this point.
If someone's having a crisis, how we can get care or services to them in a way that is safe for everyone involved, but is the least stigmatizing and traumatizing.
In Nashville, Kelsey Gibbs, News Channel 5.